came in and I said, I don't care what happens. I'm going to a meeting every day.
Yeah.
And I said, I'm not scared of a germ. You know, I used to snort cocaine off of toilet seats. And I know this disease will kill me.
I'm a sign.
What the hell?
What? I'm Dr. Haydée Brown.
I'm Dr. Sonya Sloan.
And we are AYAN.
Black and Brown Women Disruptors in Healthcare and Beyond. Okay, so aside from snorting cocaine off toilet seats, we're going to talk about measles today. And so, yes, the highly contagious childhood disease that we've been talking about since last year, you guys, when RFK Jr. took office, right? And the numbers have now exploded. And so while the United States officially eliminated measles in 2000, 25 years ago, the status is now serious. It's at a serious risk for losing that status in April of this year. So due to the continued rise of measles cases, as well as HHS's secretary's negligence under the Trump administration, the elimination does not mean zero cases. So just because we say, elimination is the status, you do still have cases. But what they're saying is no sustained person-to-person transmission for 12 months. And so over 2 decades, the United States maintained that benchmark. But January last year, the outbreaks resurfaced and the new cases are being reported across multiple states. So if the transmission continues at this pace, the country is going to lose its elimination designation, a reversal that infectious disease experts are calling deeply concerning. Dr. Aaron Glatt, the chief of infectious disease at Mount Sinai, South Nassau, described that this is a very sad commentary at this time in history that current public attitudes towards health. So emphasizing that measles is not just a serious disease, it's serious enough and capable of causing severe complications and even death amongst children and adults. So Dr. Brown, these are things that we could have prevented, right? Outcomes that didn't have to happen.
So how is elimination actually maintained? So public health experts are clear. Herd immunity is key. So at least 95% of a community must be vaccinated to prevent sustained spread. So at that level, even individuals who cannot be vaccinated, such as your infants or your immunocompromised patients, they remain protected, right? But researchers at Johns Hopkins have described coverage with a 95% coverage there as being robust herd immunity. So really noting that once your vaccination rates fall below 90%, that's where the risks of outbreaks really rise dramatically. So again, 95% coverage is robust. Below 90% is a risk of outbreaks. So in short, elimination is not automatic. It's maintained through consistent high vaccination coverage. And when that coverage slips, measles returns. So as of today, the Center for Disease Control and Prevention shows there are 996 confirmed cases of measles in the United States in 2026. And right, that might not sound like such a large number, but let's put it in context. In 2025, the entire year, we had 2,280 cases. So right now, we're already on track to exceed that. So in some states, the problem is that these numbers are huge. So South Carolina alone has reported over 950 cases. And the problem is that most of those people were not vaccinated. And if we look at this graph, you can see that who's being hit. 436 cases are in children age 5 to 11. 253 cases are in children age 0 to 4. And then 179 cases are in kids age 12 to 17. And just let that sit for a second. The majority of these cases are children. And it's not adults, it's not your seniors, it's kids, actual children. And that's the very population that these vaccines were designed to protect. So what we're doing is we're actually watching preventable disease concentrate in the youngest among us. And in other states, like Illinois, for example, they just confirmed its first 2026 case with potential exposure at a church service. And in Texas Hill Country, there are confirmed cases that have been clustered in families. And really, the bottom line is that measles is not contained. It's definitely not eliminated. And it's growing. It's growing. And so why is this serious? Because measles isn't some seasonal sniffle. It's one of the most contagious viruses known to mankind. If someone infected enters a room, the virus actually lingers in the air in that room for up to 2 hours. So that means you could walk in later and still get infected 2 hours after someone with measles left. That's crazy. So that's how contagious measles is. And that is exactly why herd immunity matters, right? It's so incredibly important because we can't depend on places being clear, right, of measles. We depend on community protection to keep those levels low. So just take a look at this. Let's roll this next clip.
Let's take a look at how it spreads. This person here is infected with a disease. In a population with no immunity, they can infect 12 to 18 others. Those 12 to 18 people can then infect another 12 to 18 people each. That's much more contagious than diseases like chickenpox or COVID-19.
I mean, that is a great graphic that Reuters put out, and it really shows how contagious this disease really is. You can infect up to 18 people if you're unvaccinated. 18, 12 to 18 is what they said, but it's a super spreader. Measles is a super spreader more than chickenpox and definitely more than COVID-19 was. And it's not just the rash or the fever that people get. It's the complications that really can harm a baby, a child, an adult. So you get complications like pneumonia, encephalitis, which is swelling on the brain, which can also cause death. Hospitalizations, that's medical bills. You can also get more sick in a hospital, as Dr. Brown and I know. Long-term disability, what happens with complications, and even death in a small percentage of these cases. So let's be clear. We may have eliminated an endemic case of measles in 2020, in 2000, and now 25 years later, it's come back with rip-roaring a vengeance. The recipe for disaster, I think, was very imminent, and we saw it on the horizon. So when you have a voice like an anti-vaxxer of RFK Jr. leading the narrative, or you have this non-research-based political dismantling of healthcare, bodaciously in our face, one should expect lower vaccination rates falling and getting rid of herd immunity. So we're watching the return of the most deadly, or one of the most deadly and preventable diseases. Like it's a sequel that we didn't ask for, you guys. We didn't need this. And here's the truth. Public health only works when it's consistent. When leaders send mixed signals, and vaccinations are going to fall, the rates are going to fall. And then, of course, when vaccination rates fall, outbreaks rise, like we're seeing now. And the numbers aren't abstract. These are people's children. These are families that are dealing with this. These are ICU beds, hospitals being struck, and a preventable suffering in the United States. It's not ideology. It's not politics. And whether or not you remember, we have to make things work at this point. So we have to figure out who's at risk and how to protect them. So of course, it's the most vulnerable people that are the unvaccinated children, pregnant women, adults whose immunity has waned, meaning like you took the vaccine years ago and may not have immunity to it anymore, as well as people with weakened immune systems. So even if you think you're probably fine, if you're uncertain about your MMR, your measles, mumps, rubella shots, check your records. And a quick antibody test or a booster is a very inexpensive way to have peace of mind. And we need herd immunity because it only works if 95% of the people are vaccinated in the United States. And Dr. Brown, right now, we're nowhere near that threshold.
So, the real deal, right, on these vaccines is that we have to be honest with one another. The vaccine is not optional if you want to keep measles out of your community. 2 doses of MMR are about 97% effective at preventing measles. And if we want this current outbreak to shrink, we've got to start returning to those smart vaccination practices that brought us to the level of elimination, right, back in before 2000. So not your fear, not misinformation, not politics, but science. Personal history aside of RFK Jr., this isn't about personalities or what happens on the toilet seat, right? It's public health. And our public health needs to be led by scientists. It has to be grounded in evidence, and it should be guided by data, period. Right? This is epidemiology 101. And let's remember, the measles was declared eliminated in the United States in 2000. Eliminated. It was not here in a sustained fashion as it's defined, right? So because vaccination rates were high enough to create that herd immunity. And we already saw this problem, right? Now what we're watching is all that work unraveled over time. So we've seen funding pulled from our mRNA research, cancer research funding has been questioned. We have this public health messaging that's diluted by vaccine skepticism at the highest levels. And now, 2026, we're scrambling to urge people to get a vaccine that was actually settled science decades ago. Can you all make this make sense? Let's go to the next clip.
Should people fear measles?
Oh, for sure. And we actually are pretty aggressive at CMS. We fund any vaccine you want to take. There will never be a barrier to Americans get access to the measles vaccine. And
as a doctor, your message to people about the measles vaccine
Take the vaccine, please. We have a solution for a problem. Not all illnesses are equally dangerous, and not all people are equally susceptible to those illnesses. But measles is one you should get your vaccine.
Dr. Brown, so after all the damage he's done and caused, Dr. Oz now stated this month, get vaccinated. It protects you. It protects your community. But that's not what was being said last year. So in an interview with CNN during the State of the Union, he said, not all illnesses are equally dangerous and not all people are equally susceptible to those illnesses. But measles is one you should get your vaccine for. So by God, you guys have heard it now, get the damn vaccine, right? But it's a little bit too late. Remember also, March 2020, we're coming up on the 6-year anniversary of COVID, where the sirens, bells and whistles, lots of people were lost, 1 million people just in the United States, right? And so what happened was, as we climb out of this darkness of, who should or shouldn't get vaccines, mRNA vaccine specifically is what the skepticism is caused by right now. And you're going to hear more about that shortly, I'm sure in the near future. But science funded, science trusted, science deployed. This isn't politics, you guys. These are people's lives. And Dr. Brown, that is about survival. And that's where we are now, about survival, again, in the United States in 2026.
It's very frustrating. It's really frustrating. So what can you do now? Here's our action plan. Check your immunization records. If you're unsure, ask your clinician or have an antibody titer drawn. Kids, ensure that they get their 2 MMR doses. The schedule exists for a reason, and we know that it works. Adults with incomplete vaccination histories, consider the booster. There's no downside to being protected, right? And then if you're exposed, to monitor the symptoms for 21 days. And you should always contact a healthcare provider before just showing up to an office, because you can spread it in that office, right? We want to be sure that we can protect all those around us. So educate. Don't just repost the memes. Be sure of the source and that it's accurate and that it's evidence-based, that it is reflecting science. And here is the insanity of it all. Measles was eliminated, and we have tools today, right now, to keep it that way. But when these vaccination rates fall below 90%, these viruses, right, they see this window, they're seizing their chance. So our public health energy should actually be going towards, curing colon cancer, advancing gene therapy for breast cancer, making a vaccine to help prevent the next, COVID-19, right? Not battling a virus that we already defeated. Hello, we already won this battle. But when these vaccination rates fall, the viruses exploit this gap. And so we need to be proactive. Let's stay informed. And let's not have another preventable outbreak become the story of our year. Check your shots. Check your loved ones. And Dr. Sloan, if you want to take it home, when science clearly works, let's fight for it and let it work for us. Dr. Sloan?
So stay empowered, stay disruptive, and remember, your voice does matter. We're Aya, contributors of MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.